A huge hospital system in North Carolina that made the COVID vaccine mandatory for its employees says 99% complied. 99%. But according to the Washington Post, 175 employees who refused to get vaccinated have been fired. Meanwhile, here in New York, Governor Kathy Hochul signed an executive order to mitigate potential healthcare worker shortages due to the state's new vaccine mandate. The mandate that went into effect today requires all state healthcare workers to be vaccinated against COVID. The governor's order significantly expands the eligible workforce and allows additional workers to administer COVID testing and vaccinations. According to the latest information from the governor's office, 92% of hospital staff, 92% of nursing home staff, and 89% of adult healthcare facility staff had at least one vaccine dose, a lot over the last few days, but that still leaves thousands of healthcare workers who are refusing to get the shot. The question is, why? CNN's Miguel Marquez sat down with two of them to find out.
At some point, push is going to come to shove, and they will say, you must be vaccinated or you will not have a job.
I will not be vaccinated.
Healthcare workers Donna Schmidt and Stephanie Touche are refusing the COVID-19 vaccine no matter what.
Do either of you have a job today?
Currently, I am employed.
And do you have a job?
I do have a job. I'm actually out on medical leave for a surgical procedure I had, but...
Both expect they won't have a job for long. Both don't trust the vaccine and its possible side effects. Both have requested religious exemptions.
What religion are you?
Catholic.
Catholic. And even though the Pope got vaccinated and says vaccines are fine and we should be getting them, that doesn't
I feel
work
he's a
for you?
hypocrite. My whole life.
This is God's messenger on earth. This is the Bishop of Rome.
He is. He was elected to that position. However, he's not abiding by the Bible.
Both say they'd gladly test for COVID on a weekly basis instead of getting the vaccine. That's not enough for the state of New York.
You need to be assured that the person taking care of you is not going to give COVID to you or your newborn.
Donna Schmidt works in a neonatal ICU.
Do you worry about giving something, COVID or anything else even, to a child that's in your care?
No, because we're all required to wear and use PPE. We're trained professionals. We know how to use it properly.
Both believe COVID-19 is real, but don't believe the statistics when it comes to reporting COVID deaths and whether the vaccine is effective.
The number of people who are hospitalized and die that are vaccinated is extremely low compared to those who are dying by the thousands every week of COVID-19.
That's a misconception.
Mm-hmm.
And
I've seen them myself.
I've
talked to them myself. Thousands of people are dying from COVID-19 every week in this country.
Here's the thing. There's several hundreds of thousands of people that were put on hospice 5 months before COVID came. They had brain tumors, they had lung cancer, they had COPD, they had other illnesses, and yet on their actual death certificate, they deemed it that it was per COVID.
You can't even accept that the vaccines work?
No, I'm not convinced that they work yet.
You neither?
No,
sir.
because there's so much suppressed science out there globally.
Both women who got COVID-19 feel betrayed. A year ago, people cheered them. Today, they feel their options for a livelihood are being ripped away.
So what's next for you two?
And that's the number one thing that frustrates me the most, is that we were all together. We were all united. And then all of a sudden, these mandates come out, and then they're fearful of losing their jobs, and they're being told, oh, this is safe, and you're in the wrong.
I believe the fabric of our civilized, free society is truly at a precipice. And when I lay my head down, not only at night, but at the end of my life, if I'm given a moment, I want to know, and I want my descendants to know, that I did everything that I could, and that I fought
For what we believe in.
for what I know to be true and right. And if that costs me everything, so be it.
So, look, a lot of people are not going to agree with what these two women said, but I will say I thank them for speaking to us. It is not easy to speak about these things. They feel very deeply in what they believe. All that said, they thought they were going to have a lot more people, a lot more nurses and healthcare workers who did not get vaccinated, who would be on their side, that could pressure the government of New York to not put this mandate into effect. But we saw those numbers go from about 84% last week to over 92% now. It is clear that if you want people to get vaccinated, mandate it.
A lot of people rushing to get the vaccine under the wire because of the mandates. Miguel Marquez, that was terrific. Thank you very much for that conversation.